Good afternoon and welcome to the webinar, Best Practices for Supporting Breastfeeding in Early Care and Education Settings. My name is Jean Chimino and I work with Linda Satkowiak on managing the Caring for Our Children 3rd Edition standards at the National Resource Center for Health and Safety in Child Care and Early Education, otherwise known as the NRC. We would like to thank Kathleen and the National Collaborative on Advancing Breastfeeding in Child Care for inviting us to present today. We at the NRC are very excited to support their efforts in building state-level programs to support breastfeeding in early care and education programs. During this presentation today, I'll be giving a brief history of how the Caring for Our Children standards were developed. I will also present the specific Caring for Our Children standards that are related to breastfeeding. And I will provide you with some strategies for how you can use our standards-based resources to influence your state child care regulations and/or your quality rating improvement system and other policies in your state. This slide just gives you the mission of the NRC, which is to improve the quality of out-of-home child care and early education programs and support the health and safety of the children they serve. We follow our mission by supporting a wide variety of audiences and stakeholders, as you can see listed on this slide here. We have resources for and relationships with all of these groups, and we feel very lucky about that. Our primary resource is Caring for Our Children. Caring for Our Children is a set of 686 National Health and Safety Performance Standards for early care and education programs. The first edition was published in 1992. Then the second edition was published in the year 2000, and our current edition, which is the 3rd edition, was completed in June of the year 2011. And that particular revision was a 4-year revision process. The standards are not developed or revised solely at the NRC. We really do rely on a large group of nationwide experts to create the standards. And in this case, we worked with 10 what we call technical panels, which are made up of 85 panel members. Those members are content experts from many different organizations and collaboratives, including the American Academy of Pediatrics and the American Public Health Association, and again, lots of other organizations, projects, and collaboratives across the country. Just to give you an idea of what the standards look like, every standard follows the same format. We have the standard language, the rationale that backs up the standard, and any comments that might be necessary. And then each standard is specified for a type of facility. And in the case of Caring for Our Children, we look at 3 types of facilities: the center, the small family child care home, and the large family child care home. And then every standard includes references and any related standards. Caring for Our Children is a nationally recognized resource, and it is the definitive source on best practices for health and safety in early care and education settings. In earlier editions, the research was not available, and so the standards were based mostly on expert consensus. But over the years, thankfully, more and more research has been conducted in early care and education programs, and there is more evidence-based material to back up the standards. One thing that's important to note is the Caring for Our Children standards are voluntary standards of best practice. They are not regulations, but they have been used by many to produce model regulations and policies for health and safety, and that really is one of the main purposes of the standards. And I'll go into more detail later on in the presentation about how to do this. We have 4 main groups that we partnered with in the development of the standards, and I just want to talk briefly about that. Group 1 are our national partners: American Academy of Pediatrics, the American Public Health Association, us at the NRC, and our federal funders, Maternal and Child Health Bureau. Then our second group, our steering committee, is made up of a representative from each of those national partners in Group 1. And then, as I mentioned earlier, we worked with technical panels. We had 10 panels that were content specific, and each of those panels were made up of experts in the field to help us develop and revise standards based on their content knowledge. An example of some of those panels are: we have an injury prevention panel, a child abuse panel, a nutrition panel, environmental health panel, infectious disease panel, to name a few. And then our fourth group are our stakeholders. And our stakeholders are made up of those groups that we serve that I mentioned in an earlier slide. For example, we had parents and guardians review the standards. We had early care and education programs, health professionals, regulators and licensing staff, Head Start, early Head Start programs, and the list goes on. And these are all the folks that reviewed our standards before we finalized them. So it really is a partnered effort to produce the standards. This is just an overview of the contents of Caring for Our Children. As you can see, there are 10 chapters, and the majority of breastfeeding related standards are in Chapter 4, which is nutrition and food service. Up until a couple years ago, the standards were available in PDF form on our website, but we are very excited to have our Caring for Our Children 3rd edition database. And this is available on our website. The website specific to the database is at the bottom of the screen there in blue. And you can go on our database and you can search by content area. You'll see where those red arrows are search boxes, and you can type in the topic of an area where you're looking for standards. For example, I just earlier today typed in breastfeeding and 68 results popped up. So that'll give you an example of how you can search the standards based on content area. If you have any questions about how to use the database, you can call our 1-800 number, which is at the bottom left-hand corner of the screen, 1-800-598-KIDS or 5437. You can also email us at info@nrckids.org, and we're always very happy to help folks search through the database and answer any questions they have about standards. One thing that we've done is we have developed special collections of content-specific standards. Our standards are very large. The book is 686 standards, and so we thought it would be a nice idea to create smaller collections of standards based on content. So the first one that I just want to point out is the top left there. The Stepping Stones came out 2 years ago, and that presents 138 essential standards from Caring for Our Children intended to reduce the rate of morbidity and mortality in early care and education. And so that's a really important collection that we have, and that's on our website as well. Then the next one there, you can see we have all the standards related to safe sleep are pulled together in that collection, followed by oral health. And then just recently, last month in August, we produced a collection of standards specific to environmental health and early care and education. Now the next two are specific to what we're talking about today. This one is Preventing Childhood Obesity. This collection focuses on healthy weight, and so it pulls those standards from Caring for Our Children that are specific to nutrition and physical activity. And then this next one, we pulled together all of these standards that were specific to the infant and toddler population. And so you're going to find infant nutrition related standards in both of these. All of our Caring for Our Children 3rd edition standards-based collections are available on the NRC website, and that's our website at the bottom there, and they're all under products. So I encourage you to go there and look through our resources. So what I'd like to do now is pull out those specific Caring for Our Children standards that focus on infant feeding practices. And what we found were that there were 9 standards and 1 appendix that were specific to infant feeding practices. And I'm just going to go over them, give a brief overview of each standard so you have an idea of what they say and what they address. The first one is 4.3.1.1, General Plan for Feeding Infants. This standard talks about how meals and snacks should follow the infant feeding plan of the Child and Adult Care Food Program, or CACFP. This standard also talks about how the facility should encourage, provide arrangements for, and support breastfeeding. The facility staff with appropriate training should be the mother's cheerleader and enthusiastic supporter for the mother's plan to provide her milk. Facilities should have a designated place set aside for breastfeeding mothers who want to come during work to breastfeed, as well as a private area with an outlet, and this standard specifies that should not be a bathroom, for mothers to pump their breast milk. The standard also addresses the introduction of solid foods for breastfed infants. The next standard, 4.3.1.2, talks about how infants should be fed on cue unless the parent, guardian, and the child's primary care provider have given written instructions otherwise. Whenever possible, the same caregiver teacher should feed a specific infant for most feedings. And the reason for that is that that specific caregiver or teacher will be more likely to understand the child's cues and respond appropriately, as opposed to if it's a different person feeding the infant all the time. This standard also states that caregivers and teachers should not feed infants beyond satiety, and this really limits overfeeding. So this standard is really building the foundation for habits that support healthy weight. Standard 4.3.1.3, preparing, feeding, and storing human milk. This standard states that the milk should be placed in a clean sanitary bottle with a tight-fitting nipple, and discusses the safe plastics to use for infants. It also talks about how frozen and non-frozen milk should be transported and labeled. For example, the date of collection and the child's full name should be on the label. It also includes reasons for returning milk to the mother, discusses transition from bottle to cup, and includes a chart for how milk should be stored. The next standard, 4.3.1.4, discusses the involved risks and strategies to follow in the event that the wrong milk is served to a particular infant. And standard 4.3.1.7, it states that cow's milk should not be served to infants before the age of 12 months unless a written exception and direction from the child's primary care provider is provided to the Early Care and Education Center. Continuing on with the standards that are specific to infant feeding practices, we have standard 4.3.1.8. This particular standard talks about how bottle feeding techniques should mimic breastfeeding. It also prohibits bottle propping and includes some other standard language around the techniques for bottle feeding. 4.3.1.9 gives instructions on how to warm bottles using tap water, a container of warm water, or a slow cooking device, and it provides specific temperatures for how to do that. For example, the standard states that the water should be no warmer than 120 degrees to prevent burning the infant. Standard 4.3.111 states that the introduction of solid food should be no sooner than 4 months, but it preferably should be done at 6 months and should complement human milk instead of replacing human milk. The last standard is 9.2.3.12, and this is an infant feeding policy. This standard states what should be included in a center's infant feeding policy. For example, the policy should cover preparation, the storage and handling of milk, the use and proper sanitizing of equipment, hand washing procedures. It should state that the center prohibits bottle propping, etc. There's more information in that standard as well. And the last item there is Appendix JJ from Caring for Our Children. This is a sample flyer for early care and education centers to display in their program. It lists all the ways that their center can support breastfeeding, and it's just a great flyer that a center could use to hang up in their center or provide in the parent guardian handbook, for example. So I encourage you to look at these resources in our database. The next resource that the NRC offers is a standards-based resource that we thought would be helpful, and that is the licensing toolkit. And we have one that's specific to infant feeding practices. And our licensing toolkits include 3 action sheets, one for a licensing agency, one for a child care provider, and one for the legislator. And really the goal for this particular toolkit is to promote healthy infant feeding practices by developing tools and products to support states' child care licensing personnel and child care providers, and ensuring environments that promote healthy weight by focusing on high impact standards of best practice related to infant feeding. Another goal is really to facilitate those conversations among licensors, child care and early education providers, legislators, health professionals, and families. Each page of the toolkit comes with an introduction, a discussion of why this is important, an overview of the related Caring for Our Children standards, and action items for promoting understanding. So I'm just going to give an example of how this might be useful. In the licensing agency's action sheet, there's a question, how can you promote understanding? And this gives 6 bullets of how a licensing agency can promote understanding of supporting infant feeding practices. And one example is that the licensing agency can review licensing regulations, policies, and procedures related to research-based infant feeding practices. And those practices come directly from the Caring for Our Children standards. Another way that a licensing agency can promote understanding is they can educate the public and all levels of policymakers on the relationship between infant feeding practices and childhood obesity. They could also develop interpretive guidelines that provide clear, rational information for determining compliance with regulations that reflect sound infant feeding practices. So this is the kind of information you'll find on our toolkit. The toolkit is located on our website, nrckids.org, under the Products and then Licensing Toolkits tab. And I encourage you to go there and check it out. Another resource that we thought would be helpful for this webinar is our Achieving a State of Healthy Weight. Achieving a State of Healthy Weight is an annual update that we do at the NRC on the status of obesity prevention terminology in the state's child care licensing regulations. And we use the Caring for Our Children 3rd edition standards as the best practices. The 2013 update was published on NRC's website on May 1st. And I think that you'll find that there are several infant feeding best practices that were used to rate child care regulations in these reports. And now we have on our website the state pages. So you'll be able to look at individual states and see how they address obesity prevention terminology in their child care regulations. Are they addressing the best practices regarding obesity prevention? And if so, how are they doing that? And then it's all in that report. So we thought that it would be a good idea to tell you how states were doing with regard to infant feeding and addressing infant feeding practices in their state regulations. And so this is just a breakdown in this chart of how they did that in the 2013 report. And I'm going to explain it in detail so you understand how we do the ratings and what the results were for this particular section, infant feeding. The y-axis is the best practice variable. So you'll see that there are 11 variables that come directly from Caring for Our Children. Are infants fed on Q? Is cow's milk not allowed for infants under the age of 1? For example, those are the first 2. The x-axis is a percentage of all state regulations for all types of care that they regulate. And we looked at 4. The center, the small family child care, large family child care, and then states also have regulations for group homes, and we did count those. The top 7 of the 11 infant feeding practices, you'll notice those are in the shaded box, are the best addressed infant feeding practices in child care regulations, so the purple and the green. And the pink box above highlights the 50% mark for the 7 breastfeeding practices. The next thing I'd like to do is talk about what were the best addressed factors. IB1, feed infants on Q, and IA2, no cow's milk prior to 1 year, are fully supported in more than 57% of state regulations. Now, one distinction I'd like to make for variable IA2 is that they do allow for both formula and human milk when they're rating states for this. Now, what were the weakest breastfeeding practices? So among the weakest of the breastfeeding practices was IA1, support breastfeeding. Many regulations do not require accommodation, so space, comfort, privacy for breastfeeding mothers, when we found that in the 2013 report. Now you might be asking, there's a lot of green there, and green indicates a partially met standard. And so what's an example of a partially met standard? Well, an example of that is looking again at the variable IA1, support breastfeeding. A regulation that states mothers should be allowed to either breastfeed at the facility or supply expressed human milk for the infant, but does not specify providing comfort and privacy for the mother, would be marked as a partially met feeding practice. Now, although it's a mixed picture of small regulatory gains and losses, each year since the 2010 baseline study, the net effect has shown a slight strengthening in terms of regulations addressing these best practices. So that is really exciting to see. Now, you might be asking, what is in the red oval? And these are the best practices for infant feeding that need the most work in terms of states addressing them better. So that's what's within the red oval there. If you have any questions about this report, I encourage you to call us at 1-800-598-KIDS, and we can answer any specific questions you may have about the report. There are many ways to connect with us at the NRC. We do have an active Facebook page as well as a Twitter account, and we regularly post about a lot of different things on both of those networks. We'll do standard highlights. We advertise webinars and conferences, ours as well as others. We have common questions that we include on there about our standards, any new research that's come out. We often share resources from other agencies. We may also do toy recalls and things like that, and sometimes we do product giveaways. We also have an e-resources, and that's just an e-newsletter that we send out every other Thursday. That's just a compilation of resources both from us at the NRC as well as other agencies. If you're interested in subscribing to that, you just email info@nrckids.org with subscribe as the subject. And this is all of our contact information. Again, all of our resources are available on our website, and you can contact us a number of ways, through our email, through our 1-800 number on our website, and I've also provided the specific database for the Caring for Our Children 3rd edition standards. And so we just want to thank you and thank everyone who is involved in this webinar today. Again, the National Collaborative on Advancing Breastfeeding and Childcare for inviting us. We're so excited to be able to speak to you today. Our co-publishers and national partners, the American Academy of Pediatrics and the American Public Health Association, and of course our federal funders at the Maternal and Child Health Bureau, and you for joining us today, taking time out of your busy day to join us. Thank you so much.